So greetings, friends and followers. This is Nurses Talking. I am Del Barcy. And here on Nurses Talking, we speak to nurses anywhere in the world, at any stage in their nursing career, whether they're students or retirees or anywhere in between, and in all disciplines of nursing, wherever they're practicing. And so today I am very pleased to welcome Rodney Rice. Rodney is a nurse anesthetist. And Rodney says that he received his bachelor's degree of nursing at Western Kentucky University, after which he worked as a trauma nurse at Vanderbilt University for 3 years and had various travel assignments before entering anesthesia school at Middle Tennessee School of Anesthesia in Madison, Tennessee. After graduating, he moved to Lexington and worked there for 19 years. And currently, he's in Cincinnati, Ohio, where he has provided anesthesia for 6 years and branched out to establish a home-based business in hemp-based wellness. He's been married for 22 years, and he's a papa of three, 26, 21, and 16. And he's also a grandpa. He says providing anesthesia has been a passion of his and has enabled his family to do many things in life. And he'll always appreciate the training and experiences as a nurse and continuing to other ventures. Welcome, 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 Rodney. I am so thankful that you decided to do this.
Thank you so much. Appreciate the invite.
Yeah. So my first question always is, what made you become a nurse? Why are you a nurse?
Mm-hmm. Well, I believe healing is in people's bones before they even know it. And this is a story that really and truly, I believe that this is the reason why I wanted to become a nurse, something in healthcare.
Mm-hmm.
You know, when my dad had a heart attack, when I think I was maybe 16, 15 years old. And throughout this heart attack, we were in the waiting room. We were supposed to go back. They told us to go back at a certain point, and I think we went a little too early. And when we went in, they didn't have him, covered up. And they had, I saw tubes, I saw this, I saw that, didn't know what it meant. But throughout that whole experience, something started ticking along in my head.
Mm-hmm.
And throughout that, and then, working as an orderly, what they used to be called way back in the day. And, healthcare was something that I wanted to do. And through all those experiences, it made me want to be able to help people in multiple ways. And so I say that was the first experience of me actually seeing healthcare and dealing with that as a young child, which motivated me to, want to do that.
Mm-hmm, mm-hmm, mm-hmm. Awesome. And so you talk about, back in the day when, you were still referred to as an orderly. Mm-hmm. That was way back when.
That was way back when.
Yeah, that was. And so, but you have been a nurse for a goodly number of years. Mm-hmm. And I know that there are more and more men as nurses, but if you're talking about 25 plus years, at that time, there weren't as many.
Exactly. So not many.
For you in a female-oriented industry.
Right. That was a little different, a lot than most industries. When I went to nursing school, there were probably out of 60 of my classmates, probably 6 guys in there, and 3 of us made it through to the end. Mm-hmm. And definitely female dominated industry. And so it sort of gave us a lot of opportunity, when it was looking for jobs and different things, and jobs and actually leveling up to administration and management positions and things like that. I think that, I wouldn't say maybe it was because I was a male, but I think, we saw a lot of males go through nursing and then step away from the bedside and move up to those positions a lot more throughout the years from what I saw.
Yeah.
That's sort of what I did also. I mean, I've done different multiple roles from nursing, from bedside nursing to management to administration, travel. And I saw a lot of those roles taken by men, a lot of times.
Yeah. And as someone who became a trust me, before you, way back when, that actually is true. That actually, I think it was encouraged, and the men in that profession, there was one, actually two, there were two men in my nursing group. And I think the opportunities were offered more to men, to move, because I think they kind of encouraged them to move away from the bedside. There was so much that at the time you weren't still allowed to do, so the thing was just, put you in a role that was not so intimate, because, very often, and I guess also for staffing, for taking care of staffing, if you had 6 nurses and two of them were male and they couldn't do certain things, then that kind of left the burden.
True.
Yeah. So you worked in a lot of areas, and then you traveled, you said.
Yeah, I did a little traveling right before anesthesia school, wanted to pay off those bills. So I traveled to some heart hospitals and different things around the Cincinnati, around the Nashville area. I didn't really go out because they needed so many around that area at that time.
Yeah. Okay. So what made you go into anesthesia?
Well, I knew that nursing was a way to do multiple things. I could have went the nurse practitioner route, the anesthesia route. It was so a great field to be able to branch out and do multiple things and increase your learning to higher learning. And so I went, when I got into college, I went from physical therapy to pre-med to this and that. And anesthesia really caught my eye. And one of the reasons out of multiple was because it's so autonomous. It was so autonomous. I could take care of patients in a different way, where I could actually literally use my skills to the max. And that really interested me. Okay. And just the field of it in general, I loved it.
Okay. Awesome. You said something just that triggered something in my head, and now I've forgotten, but it's okay. It'll come back.
Yeah.
So having done all of this, one of the things I'm asking this is because we're seeing so much dis-ease and so much dissatisfaction at the moment. Clearly, some things need to be changed. So what would you like to see change?
Well, I would like to see nursing as a whole consolidate some of the divisions in the nursing ranks. We have a lot of nursing ranks: LPNs, 2-year RNs, 4-year RNs, master's degree prepared nurses. So I feel, as a profession, for us to truly and really be looked at from everybody else as a profession, we have to consolidate those things. But it's sort of changed a little bit. That was my thinking up until the pandemic. So when the pandemic hit, hospitals and hospital systems sort of took a step back and said, we're in trouble. We don't have enough prepared nurses as a whole to take care of our patients. And this was a real deal.
Yeah.
And almost 95% of all hospital systems, they lacked prepared nurses. When a new nurse is running a floor right out of school, that signaled issues there. So I don't know which way we're going to go with it, but I think now that hospital systems are recognizing the value of what a nurse can do and who that nurse is, and the professionalism of the nursing profession as a whole.
Mhm, mhm.
Now, I think that um, that really turns the tide in healthcare when you don't have enough prepared nurses to take care of your staff. So I see I see increased salaries. I see jobs. I see less burnout. Coming when if we can get through this wave, and the nursing field can start maybe to consolidate and increase their numbers, I see a whole lot of opportunities for nurses in whatever capacity that you want to go in.
Yeah, yeah. And
Right.
Rodney, that is really one of the goals of this channel, is to showcase where nurses are,
Mm-hmm.
where we can be. I want to talk all kinds of different nurses, because I need nurses to see that we can and should be everywhere. I
Mm-hmm.
think even with all of this, I am very excited about the fact that many nurses are pursuing higher education. I'm excited about that because I think that gives us a seat at the table. And if we have
Yes.
a seat at the table, then it gives us a power with the decision making about
Yes.
what affects nurses and our salaries, our staff to patient ratio, the conditions under which we work, a good break room, anything.
Right.
you know, all of those things. So I'm very pleased to see that nurses are doing that. But as I say, a lot still needs to be changed, and I think we need to identify, we need to step into our power. I don't think that us as nurses still acknowledge or even know our power.
Yes.
I see us all the time allowing other members of we're supposed to be working in collaboration with the rest of the healthcare team, but I see us all the time allowing other members of the healthcare team who have nothing at all to do with us
Right.
directly.
Right.
This is
Mhm.
something that really annoys me, I have to say.
Me too. Me too. Because nurses truly, we have, we're direct. We are the direct link many
Mhm.
times between the patient and
Yeah,
the care that needs to be done.
yes,
The
yes,
patient and the physician.
yeah.
The patient and what the hospital system needs to do to take
Mhm.
better care of that patient. It
Yeah,
all is on the nurse's
it
shoulder.
all is on the nurse's shoulders, every last bit of it, yes. And I think we need to insist on being recognized like
I
that.
do too.
Yeah,
Absolutely.
yeah. So now that we're talking about that, and that's not recognizing and all of that, one of the things we just mentioned, the burnout and all of that. Um, One of the things I think contributes to this burnout thing is us not taking care of ourselves. We are conditioned to be the last one on the list. So my question to you, as I question everybody else, is what does self-care mean to you?
Yeah, self-care. Man, self-care, we have to do more self-care. It comes in taking more than just your 30-minute break to scarf something down and then run back and perform your duty. Sometimes it takes more of a meditation type
Mm-hmm.
experience to
Yeah,
clear your mind and thoughts.
yeah,
Sometimes it takes stepping away and literally enjoying what it means to you
yeah,
to let yourself be free,
yeah,
enjoying your family.
yeah.
To me, it's coming home knowing that my wife and kids are safe and at home, and I can be around them and let my hair down. Oops, I've let
You did
go.
that already.
I can I can enjoy them and be myself, because a lot of times we're so stringent sometimes you can't even be yourself
I know.
out on your job. So there's
Mm-hmm.
got to be somewhere or some way that you can be yourself. And a lot of times that's with family, that's with friends, that's doing things that literally take your mind away from the situation, because nurses, we see a lot. We
Yeah.
see so much and it wears on you and it tears on you.
Mm-hmm.
Before you know it, you're not eating. Before you know it, your mind is just going 1,000 times a minute throughout the day and you have no break. So
Yeah.
that's what it means to me. You got to step away. You got to take care of yourself, pamper yourself, you
Mm-hmm.
know,
Yeah.
um, you know,
Yeah.
and go to places to where you can step away from.
Yeah. Yeah.
That's real self
Yeah.
care.
Yeah. Yeah.
Yeah.
And that's stepping away. You said it several times, and that's so, so very important because you know what? Um, you can physically step away, but sometimes we don't mentally and emotionally step away. You know, you're sitting having a pedicure, and your mind is at work.
Mm-hmm.
You know, and we've got to be able to fully and completely just be with ourselves, be with whatever. For me, it's walking. If I can walk, if I can be out in the woods, if I can sit by the water, I'm good.
Mm-hmm.
Good. But you
Yeah,
have to
for me,
you got to recognize what makes you good.
exactly. And for me, it's exercise. I love to exercise. I love to be fit. Two reasons: because I got a lot of stuff in my jeans, and
Yeah.
so I've got to stop it, break that thing somewhere. So I love to exercise. I love to go around my grandbaby because I'm a pop now.
Yeah.
So I love to get her. I love to do things on the side of the nursing industry to help
Yeah.
people in a different way to get a breather
Hmm.
from a lot of things that may become monotonous as a nurse, and it can. And
Yeah.
I've been there.
Yeah.
So yeah.
Yeah. So talking about that, that leads me to your an entrepreneur. You've got a
Yeah.
hemp-based home business. Talk to me about that.
I love it. I love it. So about I would say a year and a half ago, I put myself out there, did a little something different, and I grabbed a hold of this hemp-based wellness company that we do things literally the right way. I looked at the industry, and the industry as a whole was very, very lucrative. I looked at how hemp-based wellness affected the body. Back when we were in school, we didn't hear about hemp-based wellness at all.
No.
I didn't know much. I didn't know much.
Yeah.
But now, since diving in and seeing that we as people, as mammals, all mammals actually release their own internal CBD that works with our endocannabinoid system. That's one of the systems found in the 1990s, and to help us live a better life, not even a better life, but our most effective life, and start doing things that, many times that we weren't used to doing because of pain, because of anxiety,
Yeah.
because of stress, So it's a way to help people a little differently than traditional medication.
Yeah.
And so I really enjoy it. It's been very, very good to us. And Kim and I our team in this, and we call ourselves Keeping Up with the Rices. We've always been um, in natural wellness,
Yeah.
and natural organic products. Uh,
Mm-hmm.
from when she started like a little organic, natural skin and hair care business. And then when this started, this just lined up exactly with the way she felt about natural care. And
Mm-hmm.
it's literally just caring for your body inside and out,
Yeah.
and you live that life that you want to, So I love it. It's just been amazing, amazing.
I can tell. But it's a good thing. And I realize that that thinking, that kind of thinking is catching on.
Mhm.
And I can almost see our collective consciousness beginning to turn um, from sickness to wellness. And so, I'm really pleased about that. I'm really pleased about that.
Like my mother used to say, an ounce of prevention is worth more than a pound of cure.
Indeed. Uh, yep, yeah. What would you say is your greatest achievement so far?
Um, in the nursing industry or
Yeah,
just in life? Okay.
anywhere.
Okay. I think my greatest achievement is trying to be the best husband, the best father, and the best son that I could be, and being able to literally help others because that's what's in my bones. That's what I've done all my life. And I think that out of those, I can't hardly pick one because that's what makes me up.
Okay. Okay. But I am pleased to hear you say that, because when you talked about what your greatest achievement was, you talked about everybody else around Rodney being, a great husband, great father, great son. I love it. I love it. What is your vision? What would you say? Well, I think we kind of just touched on it a little bit, but what do you see for nurses? What would you like to see nurses do going forward?
And I want to see them just step into their role. You know, I want to see them, you know, get the higher education, and bring that back not only to the higher levels of service, but bring that back to the bedside. you know Bring that higher level back, that higher level of care, because this is somebody's mother, somebody's father, somebody's brother and sister that is that's on the bed. And we see these patients at their very worst.
Yeah.
And we hardly ever see them at their very best.
Yeah.
So patients need that type of experience,
Yeah.
to
Yeah.
be able to move them through their transition through the hospital stay, no matter where it goes.
No matter where it goes, no matter where it goes. I absolutely agree with that. I want to see nurses. I want to see I want to see the president be a nurse.
Yeah, right. Me too. Me too.
Honestly, I do.
Me too. Because we are a profession, and
They're a profession, and it's a profession that forces you to gain a lot of skills very, very quickly, develop a lot of skills on your own, regardless of what they taught you. Develop a lot of skills on your own to become very innovative, very resourceful, very resilient, all of the things that you need to manage and to move things forward, and to delegate, and to think, to critically think about things and get them going. All of those skills you use on any given day. I can use all of those skills in a half an hour.
exactly. Exactly. And so, I think that utilization of those skills propagates you forward
Yeah.
more, into the roles that we want to see us in.
Yes. Yes.
Yeah.
Yes. 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 We're everywhere. I want to see us in more places. I want to highlight us in more places. I feel like if nurses had more say, we'd probably have a better world. But
Yeah.
I'm biased.
Yeah, me too. Me too.
uh, what advice would you give to somebody who wants to be a nurse?
If you want to be a nurse, check yourself first. Check yourself and see what's inside you. Caring, wanting to help heal, it comes from not just going through the classes to get a grade. It's more than that. It's about seeing what's in yourself and pushing the limits to learn what you should, to be able to go out and produce and to show yourself approved. Many times you see people just going through something just for the job, just to get through. But nursing is one of those careers that it's 80% caring and 20% knowledge. So it's one of those things that you have to search yourself. And if those roles fit you, go for it. There's so much opportunity out there for you that you can go in any type of nursing, and you can go really far, and you can find something that fits you. There's so many roles out there. There's so many roles.
Something that fits you. There is something that fits you.
Right? Yeah. It's more than what you see on TV.
Oh,
trust
me. And what you see on TV ain't real. Yeah, indeed. It is more than what you see on TV. So I'm collecting these words just because I want to know what we see in each other. Because, and what started me collecting these words is this phrase that I keep hearing that talks about nurses eat their young.
Hmm.
And so I started to think about, well, why? I know it's a stressful environment and all of this, but why? How did we get this reputation? So then I started thinking, what do we see in each other?
Hmm.
So if you had to describe the most essential quality of a nurse in just one word, what would that word be?
Caring.
Caring. Okay.
Caring goes into everything that you do.
Mm-hmm.
Patient, your education, how
Yeah.
you treat your fellow nurses and bringing them up behind you.
Yeah.
I've heard that nurses eat their young for years,
Mm-hmm.
and some of the older seasoned nurses. I've seen it.
Yeah.
They took a toll on some of the younger nurses. I
Mm-hmm.
don't know if they were afraid that they were getting older and the young nurses were getting pushed out. At the time when I was coming through, young nurses. Because of the shortage, there's always been a nursing shortage. I don't know when there has, but this is just worse now.
Yeah. Yeah.
But younger nurses were getting paid as much as older nurses still back then.
Mm-hmm.
And I think that might have been just a little bit of that involved in there and different things like that. But, never lose sight of why you got in the field. You did it to help others. And that goes with helping the ones bring them up along with you.
Yeah. 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 And I think, a lot of us get stuck in what we know or what we think we know.
Mm-hmm.
And someone else comes along. We forget that it's a constantly evolving thing. There's so much new going on. So when someone comes out of school, say, or a fairly new nurse and wants to do something one way, you can't really be dogmatic about what you think you know or what used to work
Right.
once upon a time. And the example I typically give people is if I don't know if you probably were a nurse then, way back
Mm-hmm.
when they did cataract surgery,
Mm-hmm.
people had to lie on their backs for a whole week. Don't move, do
Mm-hmm.
not move, right?
Right. And spend the night over, you know?
Your night's over. You lay on your back for nearly a week.
Right.
These days, you go in, it's you're in and out. They don't even put you to sleep.
Mm-hmm.
You're not going to sleep, and you have a new lens and all of that, and you're back to work in a couple of days, and all of it is kind of like that. There was a time when it was this way, but we have evolved, and it was this, and you need to move along with what's happening. You need to.
Exactly. We can't be afraid to learn something new.
Mhm.
Things are changing, and we've got to keep up.
Yeah.
We can't when something is brought that is new to us, and it's like give it a try.
Give it a
You know,
try. Give it a
give it
try. Yeah.
a try.
Give it a try. But sometimes, people. I see a lot of this, a lot of fear actually, um, in seasoned nurses. They don't seem to realize sometimes how much we have to give, but especially this transition from writing stuff to electronic stuff, that has
Mhm.
been hard for some people.
Yes.
And just even thinking in that way, and it has contributed to a lot of friction um, within the profession. But what you're going to do. I guess this kind of thing is always going to happen. There's always going to be changes, and those who are in this mode now will be trying to catch up with something in the future in 5 years.
Right.
Catch up
Right.
with
I totally
something.
agree. And we deal with I came from paper charting.
Mhm.
And then just here, being 6 years here in Cincinnati, we went to computer charting.
Yeah,
And it was a transition. I picked it up pretty easy, but there's some people that, it was like a struggle
I know.
to go from paper charting
Yeah,
to
yeah,
computer charting.
yeah,
Uh,
yeah,
but it's like one of the seamless things once you just open and just take your time, you
yeah,
know.
yeah.
It really makes the job easier because when I look back on doing all that paper charting, I can't stand when the computers go down and we have to go to paper charting. I just don't. It's like, no, I don't want to do this case.
I know. how dare the system go down?
Oh man, I'm like, I don't want to do it. But we have to keep open mind about everything. Keep open mind. Don't be in nursing field. All things change in life, and
Yeah.
that's how we have to look at it.
Yeah.
Everything that we do, 9 times out of 10, before we retire,
Yes.
things are probably going to change 10 times.
Yes. Yes. It absolutely will. It absolutely will. I mean, even what we wear to work,
Mm-hmm.
even something as simple as what we wear to work.
Yeah.
You know, look at how it has changed.
Mm-hmm.
You know, so there you go. Anyway, Rodney, thank you, thank you, thank you, thank you for this.
You are welcome. Thank you. I appreciate this.
Well, thank you. I really can't wait to talk to a million nurses. I love talking to nurses. So thank you so very much for
Yeah.
that.
Thank you for what you do, bringing conscious awareness to what nurses deal with and nurses impact and healthcare, and impact on families. I love what you do. Keep doing it. Keep doing it.
Thank you so much.
You're very welcome.
Okay, bye-bye. Uh-oh, what happened? Okay.